I wanted to share with you our concept for working together to improve outcomes in spine cases. A few years ago, we set up a special purpose vehicle called Spine Fix in Abuja, which essentially was to increase local confidence that spine operations or spine cases can be managed effectively in Abuja. We've achieved that purpose because a lot of cases are now being performed locally in Abuja and of course in Nigeria. The new idea we have is the concept of working together for improving outcomes in spine cases. In this case, the Brain and Spine Surgery Consortium cooperating with other people, other hospitals in improving outcomes in patients with spine diseases. So one of the things to understand is that there is a huge number of patients who are suffering from spine problems. A single surgeon cannot do all the operation. A single hospital certainly cannot. And even all of us working together, all the spine surgeons in Nigeria operating every single day cannot finish operating on all the patients that are available for surgery. So this idea is to collaborate, to cooperate in order that we can achieve more for the Nigerian patients. The terms of collaboration, of course, are that we can share information, we can share knowledge, we certainly can share equipment, and of course, share the profits and loss associated with this venture collaboration. The people we're hoping to work with from here onwards are, of course, neurosurgeons, orthopedic surgeons, physiotherapists, nurses, and other members of the healthcare team. What we want to do is to eliminate competition, but to have a singular aim of improving local outcomes and in some way reversing medical tourism. Now, the funny thing is that we actually already have competition in Nigeria. We have competition from herbalists, we have competition from pastors, we have competitions from quacks and charlatans, people who actually truly don't even know what they're doing. So we also have competition from outside operators. We have serious competition from other countries, and especially private hospitals in India, in Germany, in the UK, in Dubai, and in America. So we have a lot of competition. We need to come together to deliver better care for Nigerians so that we can get better outcomes for them and reverse medical tourism to these other foreign countries. In that way, the money we save will actually be of benefit here in Nigeria. So, talking about collaborations, we can work with, for example, the Chinese natural therapy, who use aromatherapy, they use acupuncture, they use different other modalities of treatment, but each organization knows what their limits are. So we can refer patients that don't need surgical intervention to physiotherapists. We can refer them to CNT for acupuncture, for example, and they can also see patients who need surgical intervention, who are not improving with conservative management, and send them for surgical intervention. So there's that level of collaboration. We can certainly work with orthopedic hospitals, trauma centers, where there's maybe not the expertise to manage spine cases. They can refer. We can also refer back, of course, to them for continued therapy and rehabilitation. There's a lot of this kind of collaboration already happening here in Abuja. We are collaborating, with diagnostic centers, with medical facilities, with other hospitals, and even collaborating, with home care service providers, so that we can actually send personnel into people's homes to look after them at home, which is their own natural environment, and so, solve all of the problems that may come up right there in patients. So this kind of facilitation or collaboration, it really is quite crucial. One strong partnership that we formed recently has been between the Brain and Spine Surgery Consortium and Citadel Medical and Diagnostic Center here in Abuja, and also in Port Harcourt and in Uyo. I'll show you an example of us working together. We've actually collaborated recently with an orthopedic surgeon in Port Harcourt performing an operation on a patient at the Citadel Hospital in Port Harcourt. So we have this 77-year-old patient with severe back and bilateral leg pains, who is totally unable to walk because of pain, and in deep trouble. This MRI scan shows, the patient and the level of problems in the spine. And this actually required surgical intervention because they have failed conservative management. They've already done physio, they've taken lots and lots of painkillers. So the patient will benefit from surgical intervention. And so when we decided to operate, we actually brought the patient into hospital in order that we'll be able to stop the deterioration, remove the pain, improve their quality of life. But the key thing for this presentation, of course, is the operation was performed by a team of a neurosurgeon, orthopedic surgeon, the physiotherapists, nurses, working together to deliver good quality care for that single patient. So this is, us in theater performing the operation. And the key thing is that because we've collaborated, we've joined forces, we're able to provide a clean, safe, and confident operation, for the patient. We've also done quite a lot locally anyway. We have operated on some patients awake without putting them to sleep. Because in some situations, there's that fear of spine surgery in Nigeria. Instead, people think that they're going to either die or be paralyzed if they undergo spine surgery. But we can do the operations with them awake so that they are alive, they can speak, they can hear, they can listen to music, some can sleep, some can offer prayers while the operation is going on. So those are the kind of things that we do locally in order to increase acceptance for spine surgery. So we can collaborate, bring equipment together, bring experience together, join forces, but to keep delivering better outcomes for our patients. And when we talk about outcomes, this, for example, showed the x-ray of the patient following the operation. And what we've had to do is to do what we call a decompression, where we free the pressure on the nerves, and then we've also put screws in, as shown on this particular x-ray, to hold the bones together and make sure the patient don't have any pain following the operation. So, locally, we are geared towards delivering better outcomes. And so spine surgery is no longer a 50-50 affair. Now we're getting up to 90-95% good outcome in the majority of our patients. We make them largely pain-free and also improve the quality of life for our patients. One of the things that's important really is that happy patients actually become the advocates locally. They will be the ones who will go out to actually say, yes, I had my operation done in Nigeria, and yes, we've got a good outcome, and yes, this can be done in Nigeria. Patients are the best people to actually go out and demonstrate better outcomes in Nigeria. So, we have to promote this concept that we are working together only for that, one person. So we have a few videos, of patients who have actually been through the system, who have had a good outcome, and who can testify or, demonstrate where their testimonies as to how they fared following the operation.
Aikin da aka yi min sai in ce na gode Allah, na gode mishi. Saboda aikin da aka yi min na yi shekara 12 ba na lafiya. Bara a nan asibiti wancan na zo na yi wata a ciki duk, amma a nan na samu sauƙi matuƙa.
I'm doing fine, and I think my recovery is going according to the plan.
One other important thing, of course, is that we as surgeons can enhance the uptake and interest in people having the operations locally by publishing our cases, by reporting our cases, both in the press and, of course, in the medical literature. So long as people know that these things are capable of being performed locally and that we're getting good outcomes, then they will trust us more, and they will stay in Nigeria to have their operations performed. So, working together will lead to improved outcomes in spine cases. The key thing is for us to collaborate, to cooperate in order to achieve more for the Nigerian patients. This presentation has been brought to you by the Brain and Spine Surgery Consortium. We want to collaborate, cooperate with both private and public hospitals to deliver better outcomes for patients with spine problems in Nigeria. For further information, call us on 081 2222 1616 or you can also find us on Facebook for more information. But please share this information and let us do the best we can for the Nigerian patients.